Good afternoon and good morning, everyone. My name is Claire Reedy, and I'm the Program Manager at the Health Federation of Philadelphia for the Mobilizing Action for Resilient Communities, or MARC initiative. I'm joined in the room by my colleague, Carolyn Smith-Brown, and we're delighted to have you all with us today for the MARC Brown Bag webinar series. Now, before we get started, I have a couple of notes. This session is being recorded and will be archived on the MARC website. At the moment, all participants are muted, so please use the questions pane on your GoToWebinar control panel to share your comments or questions, which we'll address at the end. Mobilizing Action for Resilient Communities is a learning collaborative of 14 cross-sector networks that are using the science of adverse childhood experiences to build the movement for a just, healthy, and resilient world. MARC is coordinated by the Health Federation of Philadelphia with support from the Robert Wood Johnson Foundation and the California Endowment. You can read more about the communities participating in MARC on our website. We also post monthly to our Shared Learning series, in which you can read about key themes emerging across sites and get related resources. MARC has an impressive National Advisory Committee, and I'm sure many of you recognize some of the names and faces here. We're very thankful that they have graciously agreed to take on this webinar series. You can visit the MARC Brown Bag webpage to see the webinar lineup, access the archives, and register for upcoming sessions, including next month on trauma-informed school practices with Chris Blodgett. Today we have the pleasure of hearing from Kathryn Evans-Madden. Ms. Evans-Madden is with United Community Services of Johnson County, where she focuses on developing partnerships and systems to mitigate the causes and consequences of poverty in Johnson County, Kansas. Prior to this role, she was the lead community organizer at Communities Creating Opportunity, where she led multiple grassroots campaigns focused on racial and health equity in the Kansas City metro area. Additionally, Kathryn led a partnership between CCO and several local public health departments in the region as part of the Healthy Heartlands Initiative, which aims to build a base of advocates for health equity across the Midwest. Her academic background is in public policy, English, and religion, with degrees from both the University of Missouri and Vanderbilt. Kathryn, thank you so much for joining us today, and I'll be turning the webinar over to you now.
Thank you, Claire. Well, hello, everyone. I am honored to be here today, and thank you so much for the opportunity to speak with you about community organizing. I think I'm having a few issues with my, if you could hold on just a minute, I'm having a couple issues with my screen.
Sure, it looks good on our end.
That's it? Okay. Then I will.
Now you're no longer, there you go. Okay, now you're in slide mode.
Here we go. All right. So yeah, I'm excited to be able to talk to you about this today. Community organizing is something that's very near and dear to my heart, and even though I'm not technically a professional community organizer anymore, I still use a lot of the concepts and ideas and practices that I learned as an organizer to do my work here in Johnson County, Kansas. And so I'm looking forward to sharing some of those ideas with you and hope that you find a way to apply them to your work in ACEs, trauma, and resilience wherever you are. So,
hey, Kathryn, I'm sorry to jump in. This is Claire. It looks like the control panel might be blocking some of your slides. So if you could the red arrow. There you go. That's a lot better. Thank you.
Yeah, no problem. Thank you for telling me. So a couple of years ago when we had the first MARC communities convening, and I was speaking to some of the MARC communities about community organizing, I got a lot of really great questions about how to do it, what it is and how to do it. You know, how do I engage decision makers around public policies? How do I build a base of constituents? How do we develop an organizing agenda around ACEs and trauma? And I was really thrilled to be hearing those questions. But I also got the sense that people felt a little bit overwhelmed by the idea of introducing community organizing methods into their work. I got a lot of questions like, do I need to hire a community organizer? Do I need to, join a local community organizing group? And so what I hope today's conversation will do is encourage you to not look at organizing as a separate sort of thing from the work that you're already doing, but as a tool to strengthen and enhance the work that you're currently engaged in. And while I do think it would be beneficial or could be beneficial for you to seek out training opportunities in organizing or to read more about community organizing as a practice, I don't want you to feel that this is something that is out of your reach. And so hopefully today's webinar will introduce you to some concepts that will help you understand what is organizing and a little bit of how. And I'll take questions at the end of this conversation. So let's start with the what. Organizing essentially means building and growing a meaningful set of relationships with people in your community who share your values and who have common concerns. And by developing these local relationships, you build a constituency of people who align their resources and their ideas and can demand change for some social problem. We hear about community organizing leading to these radical and monumental social movements and social change moments. So we think about the community organizing that led up to the civil rights movement, or we think about the organizing of farm workers in the 1960s and 70s. And what I really want to impart to you today is that organizing doesn't have to be on that scale to be truly meaningful. When I was first introduced to the concept of community organizing, it was a local neighborhood in Kansas City that was working to get speed bumps in their on their streets because they kept having cars, driving, speeding down their streets where their kids were playing. So the neighborhood came together and decided that they wanted the city to install speed bumps, and so that seemingly small effort, that seemingly small action made a huge difference to people in that community and to the lives of those children that lived there. The process of organizing is just as important, if not more so, than the outcome. And so that's something I want to make sure that you keep in mind. So what is it? How does it work? Like I said, it's about relationships. And so when you and maybe your neighbor or friends or coworkers have identified that you have a shared set of values and a shared set of concerns, you build that group as a constituency of organized people. And when that constituency of organized people also combines their resources, like money, and their ideas, that leads to a shared agenda for addressing those concerns and for creating change to whatever problem it is that you are equally concerned about. This is an especially meaningful practice, I think, for you who are working on ACEs, trauma, and resilience in your community. And I think it's especially meaningful for the people who are experiencing ACEs and trauma and for whom you're trying to build resilience, because community organizing is a process that is really good at promoting resilience. And I'm going to talk a little bit about what that means. So I think I called this organized resistance and resilience because I think those are two words that really capture the heart and soul of what community organizing is about. So as a form of resistance, community organizing is a practice that pushes back against the status quo. It says, you know what, the way things are in our communities, the fear and the anxiety that we live with, the things that are killing us, the things that are making us sick are no longer acceptable. And so we're not going to accept those factors that are keeping our communities unhappy and unhealthy, and we're going to push back against them. Community organizing also helps to reframe people's understanding of power. When I first came into community organizing, I had a very complicated relationship with power. My understanding of power was one of control, and what I love about community organizing is that it really uncomplicates people's relationship with power, and it helps people to realize that power is not a bad thing. It's not a dirty word, and it's also not a zero-sum calculation. So just because one person has power doesn't mean that I can't also be powerful and that I can't also encourage others to be powerful. So that that new relationship, that new understanding of power. Power is something that you want in order to do good for your community. It helps people to examine the resources that they do have and to recognize that there is power in their relationships. There is power in the resources and in the ideas that they share with others in their community, and that collectively that power can create some significant social change. Community organizing is a great way to acknowledge and denounce those various and intersecting forms of oppression that we all live in, experience, and sometimes might be complicit in. So, when you talk about trauma in particular, and you talk about adverse experiences, it's not just, for example, gun violence in a poor neighborhood. It's not as simple as that. It's often decades of real estate discrimination and the cost of housing and limitations on where poor people can live. So those are systems that lead to crime in neighborhoods. When you talk about sexual violence, for example, it's not just that one instance or several instances in an individual's life of sexual violence. It's culture of misogyny and transphobia that permeate our culture and make those sorts of actions common. And so community organizing is a practice that brings all of those nasty things that permeate our culture, racism and classism and religious oppression and all of those things that are hard to talk about out into the open and forces us to deal with them. And in dealing with them, then we can begin to heal, which brings me to how community organizing promotes resilience. So community organizing is really centered on stories. I'm sure all of you have in your heads a powerful story that you heard that radically shifted the way that you think about the world and think about ACEs and trauma and resilience. For me, the story that brought me into community organizing and made me want to be an organizer was hearing the story of a woman named Sandra in Kansas City who took out a payday loan to pay a utility bill for $500 and ended up owing over $10,000 within 6 months because of the high interest rates. And that was the story that really made me decide that I wanted to do something not just to help Sandra, but to help an entire community of people for whom predatory lending was a huge problem. And so I'm sure all of you have a story where you can say this is the moment, or this is the story that really made me want to dedicate my work to resolving ACEs and trauma. And so stories are really powerful. And so I think what organizing does is give people who have experienced those traumatic events an opportunity to share their stories and to really become empowered and to empower others to make changes because of those stories. Community organizing is also a great way to build community and empower people. And as we all know, social connections are a critical component of resilience. It's the practice and the effects of organizing that help people to see that they're not alone, and it helps people to understand that the sum of all of us is greater than our individual parts, and that together we can truly change the circumstances that are causing our communities to experience trauma. And what I love most about community organizing is the way that it reframes our understanding of what our resources are and what we're capable of. I can't tell you how many times in my work I have heard people say that they feel like things always happen to them, and they want to get to a point where they feel that they can make things happen. And so moving people or helping people move from a mentality of scarcity to a mentality of abundance, and to recognize that they have valuable resources that have the ability to change minds and hearts and potentially change policy and systems is really a wonderful thing to witness as a community organizer. So let's get a little bit more specific and talk about what community organizing is and what it is not. So First thing I think is important to understand is that community organizing is a process, and there is often not an end to it. So, when you're working on issues as complicated and complex and deeply seated as ACEs and trauma, there's not a clear point at which we can say we have done our work and we can hang up our hats and go home. It's not a one and done proposition, and so it's important to understand that, because it can often feel like the work never ends, or it can often feel like you take a step forward and 2 steps back, and that's just the nature of the work that we do. Community organizing is based in relationship. It's not based on manipulation or coercion. I think that relationships are the bread and butter of community organizing, and without relationships, authentic and meaningful relationships that are rooted in shared values and shared concerns, I don't think that without that it's possible to do meaningful organizing. Community organizing is rooted in self-interest, which is different from selfishness or selflessness. So self-interest is a concept that essentially means that my interests are in some way tied up with your interests. And so let's figure out where our interests align and move forward from that point. Community organizing is about the development of leaders who can solve their own problems. It's not advocacy on behalf of others or social work. And I want to be clear that there's nothing wrong with advocacy or social work. Those are both practices that are incredibly helpful and useful in the work that we do. But community organizing is really focused on leadership development and making sure that people who are impacted by a problem have the skills and have the resources available to them to solve their own problems and to continue to solve those problems even when outside resources or outside support goes away. Community organizing is a form of public decision making. So something that we always say is if you don't do it in public, it doesn't happen. So it's not about backroom or closed-door decision making. It's breaking the status quo that important decisions have to be made by a select group of people in a closed-door room. It's breaking that status quo and saying, actually, the people who are at the center of a problem, who are most affected by it, should be leading and making decisions in a public fashion so that there's accountability and trust. I've sort of already said this, but community organizing is about putting people affected by a social problem at the center of solving it. Way too often, I think we see big, complicated problems like ACEs and trauma being managed or addressed by people who aren't actually experiencing the problem. So you might have nonprofit organizations or foundations or others whose hearts are in the right place and who mean well, but they themselves, because they aren't experiencing that social problem, cannot sustain whatever grows out of the solution. So putting people who are affected by that problem at the center of it from the very start is very critical to organizing. And finally, community organizing is an understanding that power is about organized people, organized money, and organized idea. It's this idea that the power with others rather than control or power over others. So now that we have a little base understanding of what it is and what it isn't, let's talk about how you do community organizing. How does it work? Often when you think about social movements, you think about what changed as a result of the social movement. So, you think about the passing of the Voting Rights Act, for example, or the desegregation of schools and public buses. You think about in other countries, corrupt leaders coming out of power. But it's really important that we understand that those things just don't happen. Those are not sort of overnight effects. They are the result of a long process of multiple actions conducted over time. And so with community organizing, there's a cycle. There's a strategy that leads to action and that action has to be constantly evaluated. You have to think about, analyze power, who's in power, who has it, who needs it, how is it changing, how is it staying the same. From that power analysis, you get an understanding of what the issues are that need to be addressed, and then you go back to the strategy. So it's this sort of constant wheel of strategy and action and evaluation and analysis and issues, and you do that over and over and over again. And at the center of all of that is, as I've said many times, relationships and leadership development. So once again, this is not an individual organization or a coalition of grass tops leaders going through this process. Community organizing is engaging people who are affected by a social issue, building relationships with them, developing them as leaders, and helping them, supporting them to go through this process. And that cycle, like I said, continues and continues, and eventually, at some point, you get that social change that you're seeking. But sometimes that social change takes a year, and sometimes it takes 10 years, and sometimes it takes longer than that. And really, the heart of community organizing is knowing that you have to be committed to it for the long run. And that's why I think it's so critical that relationships and leadership development are at the center of it, because when you have a relationship and you care about the people who are experiencing these issues, you're going to be committed to them for the long term. And when they have the leadership skills to do this for themselves, they will be able to sustainably address these issues in their community and other issues that might come up. So one of the sort of quotes that I love to think about, you know, community organizing and what it means comes from this piece of art from an artist and activist called Ricardo Morales. If you give me a fish, you have fed me for a day. If you teach me to fish, then you have fed me until the river is contaminated or the shoreline ceased for development. But if you teach me to organize, then whatever the challenge, I can join together with my peers and we will fashion our own solution. And I think that really captures what community organizing is and what it means, and how it's relevant to the work that we're doing in ACE's trauma and resilience. So at this point, I'd be happy to take any questions.
Great, thank you so much, Kathryn. So our first question is, can you share a few good ways to get started organizing in my own community?
Absolutely. So there's some really basic things that are actually will probably be pretty intuitive to you. So as I've said, at the center of community organizing is relationships. And one way to build and maintain relationships is by doing something that we often call a one-on-one meeting. And a one-on-one is exactly what it sounds like. So you identify people in your community who you want to engage, whether it's people who are experiencing or have experienced trauma, whether it's decision makers like your city council person or your legislator, whether it is a community leader like a pastor or a teacher. And you identify those individuals that you want to build a relationship with, and you invite them for a meeting, you know, invite them to your front porch, invite them to have coffee, and have a one-on-one conversation about what your interests are, and try to understand what their interests are and see where those interests align, and share with them what you want to accomplish with your work. One-on-ones, it's kind of like the nuts and bolts of community organizing. When I was doing this professionally, I had to have like 20 or 30 one-on-ones per week. Sometimes the same people every week, and sometimes totally new people. And it's really what makes organizing truly effective is that constant cultivating of relationships. Another thing that you can do is bring people together. So if you're working on a neighborhood level or a very small community level, bring people together for what we sometimes call a house meeting, which is, you know, I do this on my block. I invite the neighbors over to my house, and after our kids have gone to bed, and we talk about what's going on in our neighborhood and some of the ways that we want to address violent crime issues or other things that are happening in our neighborhood. And we make this a regular practice. We do it probably about once a month, and we say to each other, we will make time for this, and we hold each other accountable to that. So those are some really great ways to get started with your relationship building and building your constituency.
Great, thanks. All right, the second question is, once community members are built up as leaders, how do they avoid coalescing power among themselves and instead continue to share across the broader community?
Yeah, that's a really great question. I think the most important thing there is that your community leaders have a healthy understanding of what power is and what it means. So a lot of that will be in how you develop them as leaders and how you impart on them what is power and why is it useful. In the tradition of organizing that I come from, we have a lot of definitions of power. Power is the ability to act. Power is organized money, organized people, organized ideas. Power is a product of relationships. Power respects power. Power defines the rules. So there's a number of different principles that we use to help people understand what we mean by power. Power with, not power over. So I think conceptually helping people to have a healthy and appropriate understanding of power and the kind of power that we want to build and for what is very important. I think another way to help avoid a situation like that is to set up some means of accountability. You never want power or decision-making to be concentrated in one place, right? It needs to be distributed and shared across a number of stakeholders. And that's true in community organizing as much as it is in, coalitions and collaborations. You really want to think about, as you're setting up as you're building your constituency, how can you ensure that there are checks and balances and levels, different methods for accountability, so that power doesn't become concentrated and decision-making doesn't become concentrated in one or two entities, so that it's really distributed across the board.
Great, thanks. The questions are rolling in, so we're going to continue on. The next one is, how can healthcare providers who are working on an individual level with people who have experienced ACEs work with community organizers to help encourage their patients to get involved with community-level efforts to address the causes of ACEs, like poverty?
This is an excellent question, and one that's really close to my heart. When I was organizing at CCO, I was working with local hospitals to help build social connections for patients who, they were called high utilizers, which is a term many of you might be familiar with, but frequent visitors to the emergency room because they don't have, they don't have health insurance and they don't have a primary care provider. And it was a unique challenge, really, because these were the sickest of sick patients, and their capacity to engage in things beyond their own personal health and their own family were very limited. So the way that we worked is that we actually engaged community health workers, and the hospital hired the community health workers, and then the community organizers trained the community health workers in community organizing methods, so that those community health workers who were already visiting patients and providing them with some assistance had tools and some resources to point those patients towards broader community engagement efforts. That's a very specific example. I would say more generally that there are things that healthcare providers can do that would actually be of huge benefit to social change efforts. So, for example, you as healthcare providers have direct and immediate access to your patients and to their ideas and to their concerns. And so if, for example, you're working on an ACEs piece of ACES legislation in your state. And you need that coalition that's working on that effort needs testimony from people who have experienced ACEs, and you've already distributed an ACEs survey at your clinic. That might be a perfect opportunity for you to talk to patients and say, hey, would you be willing to go to the state capitol, or would you be willing to submit a testimony, a written testimony about your experience and the importance of this legislation? So there are a number of different ways I think that healthcare providers are uniquely positioned to engage their patient population and help them to become a part of these social movements.
Great. All right, the next question is the process of grassroots community organizing inherently trauma-informed, or do organizers need to tailor their approach to reach people in communities who have experienced trauma?
Oh my gosh, this is such an excellent question, and I'm going to answer from my perspective. I do not believe that community organizing in many models that I have studied and engaged, I do not believe are trauma-informed. One of the sort of practices of organizing that I have a complicated relationship with is it's about, agitation and really trying to like dig into people's stories and help them to bring up, anger and, the feelings that will make them want to take action. And I've always sort of been challenged by that, and since I have started to learn more about trauma and trauma-informed practices, I often reject that as a method to develop leaders. I think there are circumstances where that's appropriate if you have a relationship with an individual and there's a healthy balance of power and an understanding of what the purpose of that is. But I do think that it would benefit all of us to, as organizers, to understand what trauma is and to become more trauma-informed, so that we can be more effective in engaging people, and so that we don't isolate or re-traumatize people in the process of trying to organize them. And so I would highly encourage any organizers who are listening to this webinar to connect with someone in your community who's offering trauma-informed training and really rethink the way that you engage communities.
All right, the next question goes back to the diagram that you had of the organizing cycle. And the question is, can you share more information about a power analysis?
Oh, yes. Power analysis, this could be a whole nother webinar, but power analysis is really about understanding, for your issue, for your community, how is power distributed? So if we wanted to make a change for this particular issue, who would we have to engage? Who currently has the ability to make that decision? Is that person or are those people accessible to us? If they're not, how do we get access to them? Once we get access to them, do we have enough power as a constituency to change their minds one way or another? If we don't have the power to do that, how do we get more power to do that? Who else do we need to bring into our constituency so that we can be more powerful with that decision maker? Sometimes it's asking the questions of, do we just need to totally dismantle this entire decision-making process and start over? I've seen that happen a lot on the neighborhood level where, power and decision-making is concentrated in a small number of people in the neighborhood, and the neighborhood association decides, you know what, this is not working for us anymore, and we need to rethink and redistribute the way the power and decision-making happens in this neighborhood. And so, they set up neighborhood accountability boards rather than an executive board, for example. It's power analysis. It's a really critical skill to have. It's something that I think can take many forms, and it's something that I should say needs to be constantly needs to be done, because power and decision making are are dynamic, right? They're constantly changing. And so it's a matter of constantly questioning, okay, now that we've taken this step, or now that we've engaged this stakeholder, what is our power? How much power do we have? And is it enough to get what we want?
Okay. The next question is, do you have any tips for talking about power in professional circles?
Do it carefully is my advice. You know, the word power evokes so many emotions in people, and I think we're in a period of time, socially and politically, where our relationship with the idea of power is becoming even more complicated. And so if you are going to bring up the idea of power in a professional setting, I would recommend that you think carefully about what it is you want to convey, and how you want your audience to understand what you mean by power, and what the purpose of power is, right? So again, it's not power over, it's power with. And so, you know, I've even used different words. I did a training recently where I wanted the group to talk about power, but I felt that word was too charged for the group that I was working with, so I used the word capacity instead. I mean, it essentially means the same thing. It's the ability to do something that you want to do, but I used a different word. And ironically, the group they ended up using the word power, even though I had introduced it as capacity. So, you know, I would just say be very careful and thoughtful about how you talk about power, but don't be afraid of it. I mean, again, it's not a dirty word, it's not a bad word, and it's certainly something that as people who are committed to resolving the problem of trauma in our communities, we want to be powerful. Like, we want to have power because we understand that in having power, we will have the ability to change the circumstances that traumatize people. So, so that's the best advice I think that I can give.
All right, next question is, what if the community doesn't see an issue we're trying to tackle as an issue they want to take on? For example, we're working on the issues of early childhood mental health, trauma, and ACEs, but the community has other monumental issues facing them.
So if it's an issue that the community that you're engaging is not interested in, then you have to move on, and that's a hard thing for us to do when we have, you know, we've seen the data, we've seen the numbers, you know, we've decided that this is really important, and the community has just decided that it hasn't made it up the priority list yet. And if you're going to follow a community organizing frame, then you have to sort of let it go for now. Now, I'm not saying that you have to totally say, like, we're never going to come back to this issue, we're never going to address it again. You can definitely find ways, I'm sure, to connect mental health issues to whatever the community has prioritized, and so you can continue to make those connections. But if it's not an issue that is immediately on the hearts and minds of the people who are most affected, they're not going to engage enough to have an impact, and you risk, I think, diminishing the trust that you may have built up between yourself and that community, and also hurting the relationships that you have cultivated in that community if you continue to force an issue that is not relevant or not a priority for that community. Yeah.
Okay, thanks, Kathryn. With the next question, I'm going to do a little bit of paraphrasing here. So, going back to what you described as the meeting that you convene of the people on your block, what might the equivalent of that block meeting be for building relationships between healthcare providers and community members?
Is there any more detail on that question, Claire? Or
I think they're trying to get at what might the right forum be to recreate sort of the natural environment of the block that you have in your neighborhood, but between these two rather distinct groups of people.
Yeah. Okay. So let me first say that I think the thing that makes a couple of things that make our block meetings work are that, one, we're neighbors and we know each other, so we have relationships, and two, we have like the same goals, right? We have the same interests. We have shared self-interest. So we are all committed to making sure that our neighborhood is a safe, healthy, and inclusive place. And so that's what increases our success in, regularly convening and talking through issues and all of those things. So when you're talking about healthcare providers, so I'm thinking of like doctors, nurses, community health workers who are sort of institutional figures, and then you're talking about the community, who I'm assuming you mean like grassroots, like residents of your city or town. Those two parties might not necessarily have shared interests, and so they might not necessarily have relationships. So I think before you can even start thinking about where you convene them or what the forum is for them to come together, it's very important that you think about how do you get them in relationship with one another, and how do you uncover what their shared self-interest might be. And there are a number of ways that you can do that. I mean, you can set up one-on-ones between healthcare providers and residents. You can ask healthcare providers to survey residents as they come in for their clinical visits, for example. You can use community health workers to accomplish the same thing. So start with the relationship building, and then I think the forum that you bring those two parties together in will emerge from that relationship building process. I hope that helps.
Yep, thank you very much. All right, so the last question is just how can you find out about local community organizing groups in your own community?
Okay, yeah, this is a good question. So yeah, there's so many different ways, and I think depending on where you are, you might have access to different organizations. So there are a few national networks of community organizing that are have locations in different cities. So the one that I came from is the PICO National Network. There's also the Gamaliel Foundation. There's I believe it's called IAF. And then there's a number of like workers unions or workers organizing committees that are distributed throughout the country in different cities and states. I think you could probably look online to identify who is the most appropriate target in your community, but I will say that that in my experience, community organizing networks are extremely open to having conversations with new partners and new stakeholders, especially on issues as complicated as ACEs and trauma. So I would very much encourage you to seek out opportunities to engage with them. And often they will offer leadership training or community organizing training, so you can get this has just been like barely scratching the surface of how to do organizing, but those groups will often offer trainings and leadership development workshops that will help you learn to do this more. So I encourage those for both you and for the community residents that you're serving.
Great. Thank you so much, Kathryn. This has been a really wonderful session on community organizing. I appreciate you taking the time with us today. So any last closing comments?
No, I don't think so. I welcome people to reach out to me if you have any additional questions. And the golden rule of community organizing is to never do for others what they can do for themselves. So keep that in mind as you go forward in your work.
Great. Thanks so much. I hope everyone has a good rest of their day. Take care.
Thank you.